Possibly back up just a little bit.
I'm sorry?
Just back up a little bit. Because you're like, your face is behind you. Does that make sense? So you can move the chair.
Good morning. I want to welcome you to the 17th Annual Summit on Health Disparities and Health Brain Trust. I'm excited about this, and I have to say at the top, I miss all of you. We obviously look forward to having this event back in April, but as we all know, COVID had a mind of itself, and so we are doing this event virtual. This is the first time that we've done our summit virtual. Looking forward to your feedback, and hopefully you will get as much out of this virtual summit as you have when we've been able to do it live. Been a really interesting year for the National Minority Quality Forum. We're still very much focused on our mission to build sustainable, healthy communities. And COVID has posed a unique challenge, presenting both an opportunity as well as heightened risk, particularly with minority populations who experience disproportionately poor outcomes from COVID. But it has focused attention on the problem of health disparities and has raised the bar for everyone in terms of trying to find out why minority populations historically have had such bad health outcomes in this country. And one of the places that the National Minority Quality Forum, where we've been focusing a lot of our work, is on risk mitigation. How do we reduce patient risk? Our sense is that when any American of any color, age, or gender comes to the American healthcare system, the expectation is that that healthcare system is going to lower their risk for a poor health outcome. And what we see with minority populations and underserved populations is that their risk, for whatever reason, is getting elevated, that they're not getting the outcomes that the science would suggest that they should have. So hopefully during this summit, we'll explore those reasons. We're looking for solutions and partnerships because as with our live summit, we want to try to find answers to these problems. So I want to thank all the attendees for joining with us. We're looking forward to your engagement and your contribution to the dialogue, and understand that we take your comments very seriously here at the National Minority Quality Forum because like you, we're looking for real answers that will help us provide a better health outcomes for minorities. I also want to thank our sponsors, obviously our live summit, our virtual summit, our work that we generally do could not happen without them. And so we are particularly thankful for their contribution as well as their collaboration. We've been fortunate to have some really great sponsors who work alongside with us, who are committed to the mission of not only eliminating health care disparities, but building sustainable, healthy communities. I want to thank Congresswoman Robin Kelly and her staff who manage the Congressional Black Caucus Health Brain Trust. We've been excited about working with them all of these years and look forward, obviously, to the continuing collaboration. I also have to thank my staff. You know, I get a chance to stand up in front of everyone and take a bow, but the real work done at the National Minority Quality Forum is done by the staff, many of whom you'll get a chance to meet over the next couple of days as part of the virtual summit. I know many of you work with them in programs all across the country. And I am so pleased to have such a great staff that works on these issues with me. And finally, I want to thank the partnership with the American Medical Association. It's been a long-standing partnership, and they're doing tremendous work. And I want to introduce the president of the American Medical Association, Dr. Susan Bailey.
Good morning. Thank you so much for this opportunity to join you today and for your continued advocacy around equity in medicine. The American Medical Association is grateful for our long friendship and partnership with NMQF, and now in its 17th year. We share your vision, your values, and your mission in working to ensure that all people have the same opportunities and access to affordable, high-quality health care. In some ways, our nation and America's physicians have made strides in how we care for our communities. But we have been reminded, oh so painfully in this pandemic, that Black, Latino, and other marginalized communities still face tremendous barriers to care and confront systemic inequities that have made them more vulnerable to the dangers of COVID-19. Now, of course, the true measure of this pandemic and its disproportionate impact on minority communities cannot be told without accurate and comprehensive data, which provides even greater urgency and meaning to our discussion for the next 3 days. Since the beginning of this pandemic, the AMA has been one of the leading voices calling for comprehensive data around COVID-19, disaggregated by race and ethnicity, so that we can better understand the scope of this tragedy, its impact on minority health, and more effectively manage our response effort. COVID-19 has tested America's physicians, our health system, and our communities like no event we have ever experienced. I'm so grateful for the opportunity on behalf of everyone at the AMA to be a part of your summit and to highlight some of the ways that we're working together to create a health system that's more equitable, more accessible, and that just simply works better for everyone. Thank you and hope you have a great meeting.
I want to thank you so much, Dr. Bailey, for those great words. And obviously, we continue to look forward to our partnership with the American Medical Association. We've got a fabulous team over there, and we're so pleased to be able to work with you. To the rest of the attendees this morning, again, I want to thank you for your participation. Looking forward to your comments. What we hope to do as we come out of this summit is really to move forward on the whole agenda to improve health outcomes for minority populations. So please let us hear from you. Looking forward to your participation and have a great summit. Thank you so much.